Now, this question is little interesting because they clearly ask you to draw a diagram. It's a PYQ. Using a well-labeled diagram, you have to trace the taste pathway from circumvallate papillae of tongue to the cerebral cortex. Now, taste pathway, we can also call it as a gustatory pathway. The peculiarity is we have nucleus tractus solitarius, which has three different cranial nerves involved. It has cranial nerve 7, that is chorda tympani part of the facial nerve. You have glossopharyngeal nerve, and you also have a vagus nerve here. Three together they relay in the nucleus tractus solitarius, and they carry taste sensation from the tongue. Now, when you look at the tongue per se, if this is part of the tongue, the taste from the anterior two-thirds of the tongue is carried by cranial nerve 7. Posterior one-third of the tongue is carried by cranial nerve 9, that is glossopharyngeal, and posterior most part of the tongue along with the epiglottis is carried by the vagus nerve. So we know these points because a lot of MCQ based exams they ask questions on this segment. To get into a deeper concept, what we don't know is what are the taste papillae which are present on the tongue, and what are the cranial nerves which carry taste sensations from these different taste papillae. Like for example, we have four different papillae of the tongue. We have circumvallate, foliate, filiform, and fungiform. When you look at the image here itself, near the sulcus terminalis of the tongue, that is the junction between the posterior one third and anterior two third. Okay, posterior one third, we have sulcus terminalis, which helps in development of the tongue. Just anterior to it, you have some 10 to 12 or 12 papillae, okay, situated immediately in front of the sulcus terminalis. They're very large in size in comparison to the other taste papillae, 1 to 2 meters in diameter. Though they're present in anterior two-third of the tongue, see here is the catch point in the question. See, we tend to write that because circumvallate papillae are present in the anterior two-third of the tongue, you might be confused that these are carried by the facial nerve, but not in this case. They are actually carried by the glossopharyngeal nerve. The whole anterior two-third of the tongue, the taste papillae which are present, that is circumvallate, foliate, filiform, and fungiform, is carried by 7 except circumvallate, because circumvallate is glossopharyngeal. You have to highlight this point to get cent marks in this particular question. Right, this is your first take home. So we're done with one type of papilla, that is circumvallate, and it is cylindrical in shape. Just in case in future, if they can ask the papillae of tongue for 5 marks, because tongue per se is an important question from anatomy, embryology of tongue, movements of the muscles of the tongue. They have been asked in the past. Okay, but now tongue per se, like we'll be confused whether it's a neuroanatomy question, because from neuroanatomy point of view, we have pain path. We have questions coming from the optic pathway. Okay, and we might expect questions from auditory pathway because they're part of the question. Maybe pain pathway can be a potential question. Similarly, taste pathway has been asked in the recent exam. Now, coming back to the taste papillae or papillae of the tongue, you have circumvallate or which are cylindrical in shape. Next is foliate, which is just anterior to the circumvallate at the periphery. See this foliate means they are leaf shaped. They are present on the lateral border in front of vallate papillae. Now you have filiform papillae, which are pointed like this. They are conical. They are present on this part of the tongue is known as presulcal or dorsum of the tongue. These are the reason for velvety appearance of the tongue. When you open your tongue and look in the mirror, the anterior dorsum of the tongue looks velvety because you have conical projections like this. Okay, they're smallest, they're most numerous, and peculiarity is they don't have any taste buds. They are mechanical in nature. Their function is mechanical. So these are smallest and circumvallate are the largest. Foliate is done. Now you have fungiform at the margin of the tongue like this. Okay, they are mushroom shaped as you can see. Like this. They are mushroom shaped. That means they have a narrow pedicle and a large rounded head. Right? They're bright red in color and they are present on the tips and margins of the tongue. Now, if you are preparing for any MCQ exam, including same as where they ask ascending or sequential order type of questions, if you want to know the order of size, circumvallate is the largest, filiform is the smallest and numerous. In between comes fungiform followed by foliate. Okay, just MCQ point, not important for our medical science optional exam. Now, your catch point is, take home is taste from circumvallate papillae is carried by glossopharyngeal nerve, not chorda tympani of the facial nerve. Now, from there, let's look at the taste pathway. Now, taste pathway, you have cranial nerve 7, 9, 10. Now, geniculate ganglion is the next area for chorda tympani, whereas inferior ganglion, that is petrosal inferior ganglion for cranial nerve 9, nodosa inferior ganglion for cranial nerve 10. So, from there, the first order neurons will arise. They will go in the medulla to the nucleus tractus solitarius. From there, they cross through solitaro-thalamic tract. These are the second order neurons. They decossate to the opposite side and they reach the thalamus. Which part of the thalamus or which nucleus of the thalamus? Posteroventral medial, VPM, posteroventral-medial nucleus of the thalamus. From there, the third order neurons, they go to the cortex, this cortex is known as insular cortex. You have both parietal and frontal areas. So these areas, that is Brodmann area 43. Okay, frontal and parietal operculum near the insula is the area where the final relay of these things happens. So this is the cortical pathway. So this is the complete taste pathway along with the taste papillae. Because they have asked for the image, you have to draw this image. I have given you a details with the help of a flow chart, but image is more important in these cases.